Hello, everyone, for Contours. I'm William, and today we have Dr. Hampilos from the Little Brook Nursing Home. Dr. Hampilos, what is going on with you?
Good morning, William, and thank you for inviting Dr. Segaram and myself to Contours. Today, Dr. Segaram and I are here to speak about a very important topic in long-term care, and that is the diagnosis and treatment of Alzheimer's and dementia in the elderly. As many of your listeners might know, as we age, memory loss becomes a bigger and bigger issue. In fact, um, age 65 and above, 1 in 8 people have some form of dementia. And by the time we reach our 80s, mid 80s, it's 1 in 2. In nursing homes, even in Little Brook Nursing Home, we have a population that has dementia in the range of 60%, and in some nursing homes up to 80%. That is not uncommon. In the U.S., presently in 2010, we have about 5 million people suffering from some form of dementia or Alzheimer's, and that is expected to triple over the next 40 years. And it's important for us to recognize this as professionals and as lay people and as caregivers for many of our aged population, that this trend needs to be addressed immediately. Right now in the U.S., there are about one geriatricians or geriatric medicine physicians for every 1,200 Alzheimer's or dementia patients. And if we don't address this now, either through medical schools or other professional organizations, the physicians will be in too great a demand. That tripling number will cause physicians to have a load that will increase from 1,200 patients to approximately 3,500 to 4,000 patients. So I'm here with Dr. Segaram, and Dr. Segaram is medical director at Little Brook Nursing Home and is on staff at Hackettstown Regional Medical Center. And I'd like to introduce him to talk a little bit about the diagnosis, prognosis, and treatment and follow-up of patients, residents who have Alzheimer's or some form of dementia. Dr. Segaram?
Thank you, JP. Thank you, William. Alzheimer's disease and memory loss, aging, and Alzheimer's disease is today a very important topic because people are living longer with all the bypass surgeries, heart transplants, kidney transplants, dialysis. You have people now living much longer. And when they live longer, then we have to take care of the problems which come on when you live longer. And one of that is dementia or loss of memory. And this we have, as JP said, 5 million people in the U.S. 1 in 7 or 8 people are going to be having dementia, and that's a big burden on the families and society and government, because when families can't take care of their relatives with dementia, they want to bring them to a nursing home where they are specialized to take care of the elderly. And hence, we have to, the government and the people and the healthcare industry have to concentrate on elder care or geriatrics. Now, Alzheimer's dementia is one of the forms of dementia which is irreversible. We have medicines to delay the progression, but we cannot cure it at the moment. The research is going on, where we have an enzyme called choline esterase, which goes deficient, and then acetylcholine, which is another hormone which helps to transmit nerve messages from one nerve cell to the other, dries up. And hence the messages come but cannot be sent to other neurons, and hence you can get a feedback. So the messages stop right where they came in. So we have now dementia. Then that is an irreversible cause of dementia, loss of memory. Then there are reversible causes also, like infections, like electrolyte abnormalities, like thyroid deficiencies, vitamin B12 deficiencies, Lyme disease, syphilis. So we have those things, and also normal pressure hydrocephalus, where those can be reversed. Electrolyte abnormalities can be reversed. Sometimes medications can cause dementia. Sometimes sleeping pills, antipsychotic medications, medication used in psychiatry, and many out there, even in cardiology. Some of those medications, which we take for granted, can gradually cause loss of memory. So it's very important to for us to see what medicines the people are on, and just see what electrolytes or infections or vitamins they lack, and see whether we can reverse it. And you'll be surprised when you see people with thyroid diseases. When we give them the thyroid pills, they perk up, their memory comes back. Vitamin B12 again, low levels, people, it'll when you give vitamin B12 injections or and bring the level up, their memory comes back, because B12 is necessary for nerve conduction. So these are the things: reversible causes and irreversible causes. And Alzheimer's disease or dementia has three stages. One is the early stage, where we call it minimal cognitive dysfunction, where you say misplace your car keys, misplace your house keys. Those are early signs, and if so long as you're aware that you are doing that and you correct yourself, that's early stage. But then when that happens, where you lose your way home or lose forget to take your exit, then it becomes, and are not aware of it, then it's getting to a early dementia, we call it, stage 1 of dementia, where you can still function, you can still take care of yourself, but your memory is failing, and you may not be able to balance your checkbooks, and you may not be able to do things you did before. Then we get on to stage 2, then it becomes a bigger problem, where you are unable to sleep at night, your memory is deteriorating, and you can't take care of yourself, you need help. And it's only at that stage families bring them to nursing homes, where they are specialized to take care of them, like the Little Brook Nursing Home, where we deal with so many people with Alzheimer's dementia, and their behavior gets worse. They can be noisy. They can they have to be helped even in feeding and activities of daily living. And finally, at stage 3, that's the advanced dementia. You have no chance of reversing it. And then total care. The patient doesn't talk to you. They are mute. They can't take care of themselves. You have features of psychosis. And that stage, it's a done deal, and people either have to manage them at home if there is help, or they seek the help of the nursing homes, which are specialized for dementia care. Not all nursing homes are specialized in dementia care, but some are specialized, and the staff and the physicians are trained to take care of them. And you can't take care of them like taking care of a young man. They have different issues like toileting and falls and behavioral abnormalities. So they have to know to take care of them. And some of the nursing homes have Alzheimer's unit specialized to take care of Alzheimer's patients, and that's on the rise now. So remember, this is the issue of Alzheimer's disease. Females have more chances than males to get Alzheimer's disease. Education, like if you have a college degree or you went for higher education, the chances are lesser than people who have no higher education. And of course, the family history. If you are degree relative had Alzheimer's dementia, there is double the chance of you getting Alzheimer's dementia. So those are the issues I want you to be aware of. Then diseases like Parkinson's disease, Huntington's chorea, frontotemporal dementia, and also multi-infarct dementia. That you have to know because people have strokes, mini strokes, and many mini strokes and strokes cause cell death of various parts of the brain, and then your memory is poor because nerve conduction, electrical conductions cannot pass through dead tissue. So those are things which you should know. And treatment, we have medications. We have things like we call it cholinesterase inhibitors, Aricept, Exelon, and those are and Remonil. Those are three medications we have, but they'll delay the progression. But we have no cure. Now, newer medications have come in. There's something called monoclonal antibodies, which are now being approved by the FDA to be given as shots to patients. And they destroy something called the plaques, amyloid plaques in the brain, which cause damage to nerve tissue. And like the plaques in the heart, we have plaques in the brain, and monoclonal antibodies selectively destroy those plaques. And also there are studies now on glucose metabolism. Low glucose levels in the brain can cause changes of dementia and bring it out earlier. So these are a few points I have given to you all. And as JP said, we have to detect this early. When people have minimal cognitive dysfunctions, the physician should be alert and investigate the patient and see what's going on, and whether we could start those medications like cholinesterase inhibitors early, and see whether there are reversible causes, and then we have to follow them, and when they get on to the stage 2 and stage 3, or in early stage, and then intermediate and extreme advanced stage. So these are things we have to educate our health caregivers to be on the lookout for the aging population and take care of it.
And I think that's important that the audience knows that the caregivers or relatives, family members can detect early signs of dementia. As I mentioned earlier, there are approximately 5 million people suffering from dementia and Alzheimer's in the U.S., but that's going to triple over the next 40 years. So that means that there's another 10 million people who are at some point in their lives presently developing or going into a state of dementia. And the earlier a caregiver or physician can detect this condition or disease, the better the likelihood of remedying it, maybe slowing the progression of Alzheimer's, not curing it presently. There are no cures for Alzheimer's, as Dr. Segaram said, but at least addressing it early on in stage 1 so that there's a higher quality of life over the next 40 years for that individual. I think that presently, there's a huge burden on the caregivers, and in the U.S., many of the caregivers are not in nursing homes. Many of them, for the remaining 4 million who are out, 4 million Alzheimer's sufferers who are out in the community, are being cared for by relatives, either spouses or children or other individuals. And it's important to recognize the toll it's taking on caregivers, not just the physical toll of helping someone get dressed or bathe or toilet throughout the day, but also the emotional toll it takes on these individuals. In the U.S., there are estimated to be 15 million caregivers for these Alzheimer's sufferers, and the untold resources that are being used by those individuals, not just dollar resources, but time resources, is enormous. And so we need to address that politically and socially as well.
Well, thank you very much. And you actually answered the question that I was going to ask you, which is you've told me what you two are doing and what different forms of dementia are, but I was actually going to ask how it is working with those people, and you just answered that question for me.
Mm-hmm.
This definitely is a very big issue. I personally, as a off the air entity, I am rather worried about this because my family has numerous diseases that could make them susceptible by some way or another, be it medicine or the disease itself, to actually make them very possible candidates to have some form of dementia. So this is a very serious issue that's spreading
and William,
across.
it is very serious, and you can take action. You and your friends and family can take action by um, uh, becoming actively involved in recognizing this disease, the seriousness of this disease, and the escalating incidence of this disease. Congress, our congressmen and women, senators and representatives, need to be notified. They have not stepped up to the to the plate, in my opinion. Resources have not been appropriately allocated. For example, of the entire federal budget spent on research in medicine and science, only 2.7% of it, or roughly $450 million, has been assigned to the treatment of dementias and Alzheimer's. And that's a piddle amount of resources. And so we ask, the audience, everyone, to get involved, contact your representatives. You can go online to contactingthecongress.org and find our representatives here in the state of New Jersey to communicate with. You can also join organizations like the Alzheimer's Organization, Alzheimer's Foundation of America, and the Fisher Center for Alzheimer's as well, and reach out to them for additional information and resources and help, and become involved as an advocate for Alzheimer's sufferers and dementia sufferers. And you could also reach out either to Dr. Segaram or myself if you need some additional resources. Again, my name is John Hampilos, and I can be reached at 908-832-2220. And Dr. Segaram?
908-813-2888. We will try to help you all to find ways to manage with your family relatives who have dementia. And again, reiterating the reversible causes, things like diabetes, high cholesterol, high blood pressure, those things also cause brain damage. So controlling those diseases and keeping your numbers in the right range is very important as a way to slow down this process.
Well, thank you very much. And you said that we had 2.4%. Was that the proper percentage there for the total amount that is being put into Alzheimer's research?
Yes, of the billions and billions of dollars that are spent across different diseases, only 2.7% of the entire federal budget, or roughly $450 million, has been allocated toward the treatment of Alzheimer's and dementia, as compared to other diseases, heart diseases, other central nervous system diseases, cancer, etc. And this disease, Alzheimer's, just to give you a perspective, 5 million, presently rising to 15 million, compares to the roughly 5 million cancer sufferers annually in the U.S.
I was going to say that sounded like a rather familiar number, looking at all of the cancer patients nowadays and looking at other very prominent diseases that a lot of people are trying to combat. And it really is a very small number for something so serious that is thoroughly affecting so many people across the U.S. and the world.
Mm-hmm.
I'm not even sure what the number is for across the entire planet, but it's probably not a very pleasant one. So
No, I'm sure it's a very large number.
Yes.
But, we need to address this at home, at the local level, at the state level, and at the federal level. And as I said, any attention we as citizens can give toward Alzheimer's and dementia will go a long way to helping not only our grandparents, parents, but also ourselves and our children as well in the future.
Dr. Segaram and Dr. Hampilos, thank you very much for coming in and spreading such an important word to the listeners.
Thank you, William.
Thank
For
you.
Contours,
Thank you.
for Contours, this is William.